hospital? Is there any
challenges that we meet?
Yeah.
We really work very closely together. So I guess the largest challenge that I would see is competition for clinical sites,
Okay.
because there's so many different schools that are trying to maybe begin new programs, and they're wanting to come into Catawba County because they maybe do not have clinical sites in a more rural type of area. So they'll want to come into the Hickory area, which just makes it more competitive to get the clinical sites. And you cannot train or teach a nurse without being able to take them into the clinical environment. We are a hands-on practicing profession.
Right.
So we have to, we can teach in the classroom all day long, and we can use simulation, which we do a lot. And I can even take you downstairs and let you see some of the simulators, human simulators and things that we have. But still, we are a practice profession, which means we have to be able to work with people and be able to interact with people. You don't want a nurse that's not able to talk with
Right.
you.
Yeah.
That just doesn't work. You want a nurse that knows the information, has the knowledge, and then has the skills and the ability to interact and you know, go face to face with their patients and be able to listen and hear what they're saying, and then advocate for them to provide the best care.
Yeah, so with the competition,
Uh-huh.
are we seeing what the other universities are doing and then trying to improve on that, or are we worried about the competition as such that we'll lose students to the other universities that are trying to?
Well, there's always competition for students,
Yeah.
and we can sometimes lose students based on what are the requirements or what have they already taken, and if they're wanting to come into Lenoir-Rhyne and transfer, you know, there might be those type of things because of like the core and those kind of things. But as far as competitions, I think we are always right there where we need to be.
Yep.
But every school of nursing, and I can show you this very easily, every school of nursing is held to standards.
Yep.
So CCNE standards are what we actually abide
Okay.
by.
Yeah.
And so we must abide by these standards, and we maintain our accreditation. Lenoir-Rhyne is accredited by CCNE, which is the Commission on Collegiate Nursing Education, as are many other schools. And so whenever we look at that, we're all held to the same standard there, and we will always be accredited. I serve as an accreditor for other programs across the United States.
Yep.
So I know exactly what we are required to have and make sure that Lenoir-Rhyne meets that.
Yep.
So in that aspect, I would say we're probably more competitive than other schools because
Yep.
we are going to have or always meet